Welcome to the topic on transfusion reactions. So today we are going to see about hemolytic and non-hemolytic transfusion reactions that occur. So what is febrile non-hemolytic transfusion reaction? As the name says, there is a febrile. The patient is having fever and it is non-hemolysis. So if there is no hemolysis, then what happens? The donor in the donor bag, there is donor WBCs. The donor WBCs will interact with the recipient antibodies which are present in the patient or recipient's body. So when the WBC interact with the antibody which is present in the recipient's body, then the WBC will be releasing the cytokines. Because it is antigen antibody, it is forming a reaction. So therefore cytokines will release from the donor WBCs. Now these cytokines will produce the systemic inflammatory response which presents as fever and chills within 2 hours of transfusion. Since here the Coombs test remains negative because it is mostly about cytokines which have been released. So this can be asked as one of the two ways. Preformed antibodies against donor leukocyte antigens and cytokine release from transfused blood. So either of it is the mechanism for febrile non-hemolytic transfusion reaction. How will we prevent this? This can be prevented by leukoreduction. It is a process that removes or reduces the number of WBCs from the blood components before transfusion. So when the WBCs are less, then the chances of the WBC interacting with the recipient's antibodies and producing the cytokines which initiate the systemic inflammatory response system is also less. So therefore this can be prevented with leukoreduction. Let's see what happens in acute hemolytic transfusion reaction. As the name hemolysis indicates, there is hemolysis of the RBCs. But when does it occur? It occurs because of ABO mismatch. What is ABO mismatch? It happens when the recipient who is A positive is supplied with B positive blood group. So what happened? The recipient will be having a anti-B antibody. Since they have the A antigen, they will not be having antibody against A antigen, but they will have anti-B antibody. So the blood which is being transfused to them is B positive. It is a wrong blood bag which has been transfused to them. So the antibody which is present in the recipient, that is the anti-B antibody, will react to the B antigen in the wrong bag and it will produce hemolysis of the RBCs. So this will be resulting from complement activation and antibody attack. Everything will cause RBC destruction and hemoglobin release. So symptoms will begin within minutes because the antibodies are already present and the complement is ready to be activated. So it will present within minutes and the presentation will be fever, chills, flank pain. The recipient will immediately complain of impending doom sensation. So all this indicates acute hemolytic transfusion reaction. Since the etiology is antibodies, the Coombs test will be positive. And in LDH, elevated LDH also indicates that there is an underlying hemolysis that is going on. What does delayed transfusion reaction mean? The patient will receive RBC transfusion intraoperatively without immediate complication. After 2 days to a week, there will be gradual hemoglobin decrease, indicating that a hemolysis is happening. And the Coombs test will also be positive, indicating that there is involvement of antibodies. So what antibodies? The antibodies in the donor bag against the minor antigens. The recipient might have RH, Kelly, Duff, KID. So against all these, the antibodies can be present. So because of the reaction between the antibodies and against the minor antigens, it is resulting in a delayed transfusion reaction. What does transfusion related acute lung injury mean? That is TRALI. Here the neutrophils that is present in the recipient's body will get abnormally primed to the cytokines that are present in the transfused blood products. So, because of this abnormal reaction to the cytokines that are present in the transfused blood product, it will attack its own lung, therefore presenting with ARDS-like syndrome with bilateral crackles and hypoxemia that develop within 6 hours. So this is the key point over here. When the lung injury occurs within 6 hours, ARDS-like syndrome that occurs within 6 hours of transfusion, then it is known as TRALI. So this is not cardiogenic. This is a non-cardiogenic pulmonary edema because the heart is totally normal. But still we do have a pulmonary edema because of the increased capillary permeability. Why do we have increased capillary permeability? Because the neutrophils are attacking its own body because of the abnormal reaction that it is produced to the cytokines that are present in the transfused bag. Let's see what is TACO. TACO is transfusion-associated circulatory overload. The mechanism is very simple. So when they have a heart disease and when large quantities of crystalloid and RBCs are administered, then the heart cannot pump or take up this volume, extra volume, and therefore it will result in a circulatory overload. That is, they will be presenting with pulmonary edema, which is because of the problem in the heart, which is known as cardiogenic pulmonary edema. That's what this is because the left heart cannot handle the increased volume. So this will happen in a history when they have a history of heart failure or MI and they are loaded with multiple blood products. So mostly the clinical example will be an elderly person who had a prior MI, develops dyspnea and bilateral crackles 30 minutes after receiving crystalloids plus 4 unit of RBC. Here if you see, when they have a history of MI or a heart disease and they develop circulatory overload 30 minutes after receiving the crystalloids, then it is typically due to TACO, transfusion associated circulatory overload. The other point over here is TACO can also occur in those with no cardiac history. But when they don't have a cardiac history, they will be presenting after 6 hours. That is, the heart will try to compensate the increased overload, but still it cannot compensate. So by the time it presents with the symptoms, it will be more than 6 hours. So what is the diagnostic approach? Diagnostic approach is chest X-ray is appropriate next step when the elderly develops bilateral crackles. So the point here is TACO is more common in patients with MI or heart disease. But even patients with a normal cardiac function can develop TACO. So how do we know whether it is TACO or a TRALI? It is a timeline which helps us to decide. When there is an ARDS-like picture with less than 6 hours post-transfusion, then it is TRALI. When there is ARDS-like picture more than 6 hours post-transfusion, then it is not a TRALI. TRALI has to be definitely less than 6 hours. In that case, it is TACO, and this happens in those with no heart disease. When there is a history of heart disease, then it can be transfusion-associated circulatory overload irrespective of the timeline. So this is in short about transfusion-related reactions. I hope I have made it clear. So if you like my videos, you can give me a thumbs up. All the best for your exams. Have a good day.